All right, let's talk about the anatomy that you will see on a pano. Here we go. So on a pano, we're going to first divide this into more of the structures that we'll see in the maxilla. So there's a lot to be seen in a pano on the maxilla and the mandible and all the surroundings, and it just takes looking and memorization. It's memorization, just like your dental science. And the thing that I have noticed in my years of looking at panos is that in some panos, certain structures really stand out and others do not. And this depends on the patient, the size of the patient, their anatomy, the pano machine that was used, how the person set the patient up to take the image. So you're not always going to necessarily see everything clearly. Things can be obstructed. We already, or depending on which lecture you've listened to first, in the other lecture we talk about how airspace obstructs hard tissue and how soft tissue can obstruct an airspace, and then how ghost images can obstruct everything. So it just depends on so many circumstances. But let's talk about what in general we should be seeing most of the time. So first of all, we have the mastoid process. That's number one. Number two is the styloid process. You usually see this and the soft tissue of the ear will kind of be draping over this area. We have the external auditory meatus, or sometimes I've seen it just written as the ear canal. 5 is the articular eminence. This is the kind of the bump that the condyle rides up to. And then 4 is the glenoid fossa. So it rests in the glenoid fossa, and as you open it comes up to the articulating eminence. Maxillary tuberosity is 8. That's the kind of bulging bone behind the last maxillary molar. 9 doesn't have, that's some kind of a fossa or a foramen. Is it the infraorbital foramen? They don't have a 9 there. I think it's the infraorbital foramen. 10 is the orbit. 11, we don't have 11 there. Why are we missing certain things? 11, incisive canal, I believe, is what 11 is. Incisive canal. 12, incisive foramen. So there's an opening here. That's the incisive foramen. That's when you give your nasopalatine injection. 13 is the anterior nasal spine. 14 is the nasal cavity and the concha. 15 is the nasal septum. There's a couple panos I saw that's, you hear about people saying, well, I have a deviated septum. And boy, oh boy, there was one film that you could see it super well. It was like, it just went off to the side. 16 is the hard palate. You can see it's like a radiopaque line hovering above the apices, the hard palate. 17 is the maxillary sinus. Through here and through here, that's the maxillary sinus. 18 is the floor of the maxillary sinus. So you'll see a couple kind of thin white lines. You'll see the whole sinus, and then you'll see the floor of the maxillary sinus. So this is actually the floor of it, and then that whole space is the actual sinus. Zygomatic process is 19. That's right here, kind of a thin radiopaque area that should be above the coronoid process in the condyle, unless the patient is not positioned correctly. And then the zygomatic arch is thicker bone. So we have the process, and then we have the arch. Okay, let's see if we can see some of this stuff on some x-rays. So we have the external auditory meatus, or the ear canal. I don't think that that's a very good representation. I have seen other images that show a much clearer, it's like a dark little circle. So I'm not a big fan of that because I don't even really see anything that it's pointing to. I'll try and find, but it would be up in this area anyways. But we'll try and find another image that shows it better. Zygomatic process of the maxilla is 2. So we got this here. Zygomatic process of the maxilla. Let's see, 3. I think 3 is probably pointing to the orbit. 4 is pointing to the orbit. So, boy, some of these are just kind of kooky, bonkers. What is 3 pointing to? Oh, maybe the foramen. It could be, I suppose, pointing to the foramen. But 4 is the orbit. Oh, this up here is the orbit. This is the maxillary sinus. And here again, the orbit's up high, maxillary sinus down low. Okay, so what else do we have here? Anterior nasal spine and the septum going up. The hard palate here, the hard palate, and then we have a shadow of the hard palate, this double line. This is the shadow of the hard palate above, but the more clear line is the actual palate. And then the zygomatic process, or like the cheekbone kind of is what we call it, comes over here. Okay. So then we have the articulating eminence. This is what that condyle rides up on. And then here we have our, this is the fossa, the glenoid fossa, and then the articulating eminence. We have the maxillary tuberosity, would be right about here. I guess this person, maybe it's up higher because maybe they have some bone loss. Maxillary sinus, this is the maxillary sinus, here and here, this kind of open area, maxillary sinus. Zygomatic process would be through here. Zygomatic process. Okay, so then let's point out some images of the mandible and the surrounding structures. So here we have the condyle. Where's my little pointer? Here we have the condyle, and we have the mandibular notch. And then this is the coronoid process here. I'm not sure why they don't point that out. Oh, they say 3. Oh, they do. Okay, yeah. 3 is the coronoid process. Here we go. 4 is the mandibular foramen. So we have, sometimes you'll see a little opening or a little hole there. And then we have the mandibular canal through here and the mental foramen. And then we have the hyoid bone, which usually comes down low, but sometimes depending on the patient position, it can be superimposed over the mandible. But usually we'll see it down below the, the border of the mandible. The mental ridge is 9. That's through here, the mental ridge. Now we're missing, what's 10? 10, 10, 10. Let me see if I can find it in the book here. Sorry, you hear my... So 10, it says, is, oh, the mental fossa. So we have, you'll also see in this area sort of the submandibular fossa here and here. I don't think that's not put in here either, but you'll see the mental fossa here. 11 is actually the lingual foramen, and then what the circle around it is pointing to the genial tubercles. And then the styloid process, I think the styloid process must have been part of the maxilla. That's probably, yeah. So, and then 16, so 14, we have the internal, 14 and 15, so riding all the way up here is the internal oblique ridge, and then sometimes you can see a second line that's the external oblique ridge. Okay, so let's see if we can see it in real life. So we have the condyle here. You can kind of see the fossa, or the notch, the mandibular notch, and then the coronoid process kind of here. It's a little bit blurry, mandibular notch, and then coronoid process. They're pointing to, it's, you just can't see it. It's very, very faint right through here, but this is the coronoid process. Mandibular foramen starts up here, and then you have the canal running down here. You can see it a little bit better here, the mandibular canal, and then the mental foramen usually pops out right around the bottom of the premolars, mental foramen. Mental ridge, styloid process. You can see it a little bit here, sticking out here, the styloid process. And am I missing anything for, okay. Here we can see again the mandibular canal. We can see this here. We can see the internal oblique ridge through here. We can see the angle of the mandible here and here. That's the angle of the mandible. And then the hyoid bone is up a little high here. That's the hyoid bone. Sometimes it comes down a little lower. Let's see, we have the inferior border of the mandible. So there's the angle of the mandible and then the inferior border of the mandible. Submandibular fossa are these kind of darker areas down here. So some might say, oh my gosh, you have a gigantic abscess. But no, it's just the fossa, so it's a thinner area of bone there. External oblique ridge up here. External oblique ridge. Soft tissue of the ear is over here. You can see this is the soft tissue of it's kind of light and fuzzy. Okay, so here's some, I felt like I added these in. They're kind of random. They're mixed in maxillary and mandibular. It's not categorized like the first set, but I really liked the clarity of these. I like the clarity of these panos and the bright red arrows. So these are all a little bit mixed up, but as in they're not chunked up into nice categories. They're just kind of, I think, whatever they thought popped out clearly on the pano. But I wanted to use these because it's just more kind of studying. So one is the right condyle. So here's the right condyle. Here's the left condyle. You know that because here's an L, and then there would be an R over here. So this is the left side. So this is the condyle and the condyle. Number 2 is the neck of the condyle, so it comes down lower, the neck of the condyle. And then we have the mandibular notch, and then the coronoid process, here and here. Let's see, 3 is pointing to, what is 3 pointing to? The inferior border. This is actually pointing to a ghost image. So if you look here, and if you look here, this is pointing to a ghost image of the inferior border of the mandible. So I don't want this, hopefully this doesn't. I liked these images because of the clarity, but I guess they're pointing out some things that are anatomical structures and then some things that are artifacts. So 3 is an artifact. That's a ghost image of the inferior border of the mandible. So hopefully that doesn't confuse anybody. 4 is the inferior border of the right mandible. So this is this over here is shown in a ghost image over here, and then here that's shown in a ghost image over here at 6. Let's see. 5 is the floor of the left orbit. So we get the floor of the left orbit here, probably the floor of the right orbit over here. We can see the maxillary sinus, floor of the maxillary sinus pretty well here and here. Let's see, number 6 is angle of the left mandible. We got the angle of the mandible here. And then here's a hyoid and hyoid. And then the styloid process is, there's the ear canal. See that really good little hole right there? And then is this the styloid process or is this? I think it's this because it's a little skinnier and longer. And then you can kind of see this tissue of the earlobe here. It's kind of soft tissue looking right there. So there's just lots of things to kind of pick out. So when you're looking at some of these clear images, take a minute to look at things like air spaces. So you can see this big air space, that double air space here, and then down into here. So just kind of take a minute to, you can see the fossa, mandibular fossa. So kind of just try and see if you can pick out things that aren't even labeled, in all these various panos. So let's go to the next one. So 1 is pointing to the posterior wall of the right maxillary sinus. So this is the posterior wall. This is the floor of the sinus. Number 2 is pointing to the zygomatic process of the right maxillary maxilla. So here's the zygomatic process. And then we can follow it. And then it goes up this way too, the zygomatic process. but this right here is the start of it. 3 is the hyoid bone. You can see that here. The hyoid bone, we kind of pointed that out before. 4 is the anterior nasal spine. 5 is the wall of the infraorbital canal. 5 is the wall of the infraorbital canal here. 6 is the hard palate. Right here we can see a pretty good line, and then this second one up here is a shadow or a ghost image of the hard palate. 7 is the image of the contralateral part of the hard palate. So this is basically, that just means that's a ghost. That's a double image. It's a double real image. So here's the bottom one is the palate, and then there's like a double or ghost image of the palate. Okay, let's look at the next one. So 1, are these all the same? Oh, it is the same Pano. Oh, I didn't notice that until just now. Okay, 1 is pointing to the vertebrae, so we can start to see the vertebrae here, and we can see it over here a little bit. 2 is the inferior border of the zygomatic arch. So here we go. So that was the process up here, and then this is the inferior border of the zygomatic arch. Right mental foramen is 3. Mental foramen is 3. Nasal septum, so we're going up into the nasal septum here. Left pterygopalatine fossa is 5. 6 is inferior alveolar canal. 6 is so we can see it here. These usually show up pretty good. This one, it's a little harder to see, but it runs down here. And then the white shadow in the center is a ghost image of the cervical vertebrae. So this kind of white that's over the anterior teeth, that's a ghost image of the spine. Okay, different Pano here. We can see the ear pretty well. Do you see, if you can kind of like here's the inside, the ear canal would be in here, but you can see that all the soft tissue of the ear right through there. And then number 6, I'm jumping ahead, is the styloid process right through there. Let's see, but number 1, so here we have the earlobe on the other side. Number 2, I'm not even going to mention number 2 because this is something we haven't talked about at all. I'm not going to test you on it, but well, I'll just say what it is. But it calls it the anterior ethmoid air cells, but that's nowhere in the book. That's something different. But look at this. What is this? What is that? That is a deviated septum. Isn't that interesting? Whoop. And then this right here, it must be some kind of a growth. They're calling it the concha bullosa. So I'm just wondering if it's something that is, either a benign tumor or something that is obviously grown somehow that it shouldn't, and it's causing this deviated septum. Let's see. So 5, inferior turbinate. We didn't really talk about that either, so don't worry about that. And then 6, we talked about, that's the styloid process, and then 7, the epiglottis. We've talked about the epiglottis in the textbook, but sometimes I think it's very difficult to know exactly what they're referring to, but you can kind of see this soft tissue, faint soft tissue part of the epiglottis. Sometimes they point it out, and I say I don't see it because it's very faint. It's soft tissue, so it's very faint. So there's just some interesting things, and then you can also note this is a very deep smile. So the patient has their chin tilted down, and then you can see it kind of brings the hyoid bone up closer to the mandible. It kind of brings the condyle and the coronoid process kind of up. Here's a very good picture of the auditory meatus. And what did we call? Sometimes I've seen some people just say the ear canal, but an auditory external auditory meatus. That's a very good image, super good image of that there. Nice little round, and it's really close to the zygomatic process. Okay, so let me see what is next. Oh, we're still going. Okay, so, oh, and this is where it says it. So right ear canal or auditory, external auditory meatus. Number 2 is the coronoid process. That shows the coronoid process very well. Number 3 is the soft tissue outline of the nose. You can see sort of the actual soft tissue of the nose here. And then posterior surface of the tongue is 4. So we get a little bit of the tongue here, soft tissue, you can see that. The sigmoid notch or the mandibular notch here is 5. And articulating eminence up here, the articulating eminence right up here is right there. So, good, okay. And another one, let's see, this goes on forever. Let's see, so we have the oropharyngeal airway. That is number 1. So you can see, this starts jumping out at you a lot. See, you got these 2 air spaces that kind of, and then go down to the glossopharyngeal airway. And then we have the palatal, that just, you know, because the tongue's not to the roof of the mouth, so the palatal glossal airway as well. But let's see, 1 is the glossopharyngeal, 2 shows the lower surface of the soft palate, so this whiter area that kind of looks a little ghostly here and here, this is the soft palate. The zygomatic temporal suture, we haven't really talked about that, but that's right here. You can see that on the zygomatic arch here, and there's the zygomatic process over here. Zygomatic process, and this is a suture that they're pointing out, but I wouldn't worry about seeing that on very many pictures. And then superior margin of the tongue. So the superior margin of the tongue, and it's not to the palate. And so we have this dark airspace. Base of the middle cranial fossa. So we can see some cranial fossa just because they're dipped so deep down. You've got this deep, creepy smile. Okay, I'm going to stop there and then we'll talk about critiques or techniques. Sorry, techniques.